Thank you all that are in attendance. I appreciate your time and look forward to sharing with you about preventive and therapeutic interventions, how we can treat the whole person through integrative care. So what will be covered today is we can't begin a presentation without going back to our good old DSM days and defining what addiction is. Then we will review how addiction falls into a preventive model and review kind of the basics of what preventive care is, what it looks like. Then we will link prevention to what is integrative care and put addiction, prevention, and integrative care together into a conceptualization of what is whole person care. One way to do this is to link antecedents and triggers through a stress model. And so we will review the components of a whole person integrative care model with the uniting glue of this integrative model being stress. Something I don't think anybody listening to this presentation has any of. Yeah, the world of integrative care is very present. I don't think it takes a lot from any of us. We all know that healthcare is changing. We all know that healthcare needs to change. Just recently, the president of the American Psychological Association in 2015 made a statement that America will be healthier because our healthcare system will treat us as whole persons. That is, the separation between physical, behavioral, and mental health will have disappeared. Our very own Dr. Melee, our Chief Clinical Officer in Psychology Today, wrote, "Successful outcomes for addiction recovery programs require both an interdisciplinary and holistic approach. The holistic approach considers the biological, social, environmental, personality, emotional, and spiritual variables that contribute as well as maintain addiction." He went on in the article to discuss how this integrated holistic approach moves the clinician beyond the biopsychosocial model that many of us learned and looks at how we can truly address the maladaptive behaviors and personality traits. It is here that we really can understand the multiple facets and the multiple etiology of addiction. And I don't think it's a far stretch for anybody on this call to acknowledge that we are dealing with chronic maladaptive ways of dealing when we are dealing with addiction that go beyond our CBT and DBT models, our cognitive behavioral or dialectical behavioral therapies, that go beyond insight with non-judgmental acceptance, that link our support for our providers with education and linkage between the variables listed above. So where do we begin? Whole person addictive care or addiction care. I don't think this is a complex topic, but in an effort to all be on the same page, I want to go back to our basic DSM days. What is addiction? I think it's safe to say that addiction is the persistence of a use, the persistent use of a substance, despite the impact that that persistent use has on that person's health, that person's relationships, that person's work relationships. And over time, this persistent use becomes chronic, which builds a tolerance. If you haven't caught on, the red are the key terms that I'm trying to get you to take with you. And this tolerance is essentially the need for more and more of that substance to achieve the same impact. Withdrawal is when we take that substance away and the patient says, give me more, give me more, give me more. And I am here to suggest that addiction is more than brain function and behavior. It is more than neurology. It is more than psychiatry. It is more than psychology. And here at Sovereign, we have many specialty programs, some listed below, that address each of those integrative components. If it be a cognitive behavioral model that many of us go to as our evidence-based practice, to looking at what kind of patients are we dealing with when we're talking about addiction with eating disorders? What are our pain? How does a whole person care model fit into TMS or a NAD or a detox program? Some questions that as we progress through the presentation, I encourage you to start thinking about these specialty programs and the patients that you see and how whole person integrative care may change how you approach your treatment. So we spent a little bit of time talking about addiction. Now what I would like to do is talk a little bit about prevention. Is there anybody here that can say that they want to be sick? Have you ever met a patient that wants to be an addict? I think it's very easy for each of us to empathize and understand disease and want to prevent disease. I think each of us, through our academic careers, have certainly heard about relapse prevention. And I think each of us makes mindful decisions to avoid illness. And when given the choice, would you prefer to improve your health or decline your health? And we are certainly hearing more about relapse prevention, avoiding illness, improving your health in the media, certainly over the past 10 or so years. And many are making recommendations as to how to do that. And some of these recommendations come in the form of assessments. Some of these recommendations come in the form of testing. Some come in the form of prescription. So instead of prescribing medication X, Y, and Z, we are prescribing lifestyle change. Things like the role that exercise and sleep and how your team of providers works together. And we'll talk more to that later. But Do we ever think about the cons of prevention? I don't know about you, but when a patient comes to see me, I have very few patients that don't have an idea of what they need to do. The problem is they don't do it. Behavior change can be difficult. How many of you can honestly look at yourself and say, there is not an element about who you are, what you represent, that you don't want to work on? But for some reason, we have chosen not to tackle that challenge. There's no secret that some of these assessments simply don't measure what we want them to measure. And going back to our biopsychosocial days, how many of you assess the patient's readiness to change? The Stages of Change by Prochaska, a great model to continue to review that is mentioned in multiple presentations. And of course, if you're following integrative care and how the healthcare field is changing, we always talk about money. Money for the patient. Do I have to spend energy on implementing a preventive program? When do I implement this into my practice, either clinically or operationally? There are some variables just to keep in mind. But this model has been around for some time. In the world of medicine, we heard about the psychiatrist Dr. Engel back in '77 writing an article in Science that he proposed this biopsychosocial model of medicine as a founding principle of what is integrative care. But it was Hippocrates that said, I would rather know the person who has the disease than know the disease the person has. And I think that one sentence really summarizes the transition from traditional healthcare into what is whole person integrative care. It is knowing the person, something that in the world of mental health, we are experts at. It goes beyond understanding the biology or the physical aspects. It goes beyond understanding mechanism, the physiology, what makes us work. It goes beyond understanding the pathology or the diagnosis. It goes beyond understanding the chemistry. It is truly the marriage between each of these elements. You certainly need a team that understands biology, mechanism, chemistry, and psychology, the beliefs, our emotions, our intentions. If we go back to Dr. Mele's slide, he lists a pretty comprehensive list of variables that should be addressed. So whole person care, what does it look like? Let's focus on the disease is what pathology the patient has, not the patient defined by the disease. And sometimes we have to conceptualize what the patient presents with as symptoms. And we need to look at how these symptoms manifest into an illness. Why is it that we turn to certain foods when we turn to them? What role does poor sleep have? What role does our emotional supports and our environmental supports have? How do those define our internal sense of self? And what happens if you have a physiological stressor? Oops, I gave you the hint. I think what integrative whole person care does is what each of us as providers want to do. It is what we aim to do. It is about giving our patients a voice in their change. If we can give a patient a voice, then we can give the patient a choice. So how do we do this? Some of the motivational interviewing literature will talk to how do we elicit and interpret the patient's story. Whole person care is really about developing relationships with your patients. In the addiction world, I think it's well documented that having a relationship is about consistency, something often missed. So strategies towards prevention and optimal health mean how do we interpret that patient's story with intention and an awareness to each of those variables listed. It goes beyond identifying addiction as a problem, but explores the relationship as the center of your care. And as future slides talk to, we become very proficient in how we connect the triggers, the mediators, and the antecedents to why we do what we do or why we don't do what we do. And we become more proficient in our assessments and procedures, and we learn when and how and who we need to collaborate with, so that in this complex world of addiction, we are able to address priorities. We are able to address and cycle through the many facets of what integrative care truly is. So I don't know about you, but I have had some stress in my life. And I encourage you to think about a stressful time. This is an artist's depiction of a moment of change. This painting was done after 9/11. The artist's interpretation is symbolic, spatial, and I like it because it shows multiple perspectives. And in the days of Picasso, Picasso used to say, I want to make something simple by showing multiple perspectives. And isn't that a nice parallel to what we deal with as we work through stress? Isn't that a nice parallel to what happens when change creates chaos? For many of us, change is the trigger. For many of us, change is what creates chaos. And how do we work through it? We work through it with creativity. So the next couple slides are going to talk about a stress model. Then we will link the stress model into physiology, pathology, and psychology, and wrap it up with some specific addictions and how they impact the whole person. How many of you use the ICEBERG model when it comes back to stress? If you go back to Selye, S-E-L-Y-E, work, often we think of problem solving and walk through stress with an ICEBERG model. While this slide is not as clear as I would like it to be, what I want you to focus on is that in any iceberg, the life experience is what is below. And we often don't see that. But as life experiences come about, we are collecting data, and this is how life goes day by day. And as we know, we have some good days, we have some bad days. And then an incident happens that arouses us, and we get a spike. And hopefully we're able to use some of our CBT and DBT models to bring that spike down. But before you know it, life presents another stressor. And like many of us, This can be a very short timeline. And I explain the plateau here as the point where you have lost your voice, the point of where the stress has taken over, and the point of where you do not have control. And you may be hospitalized. And as you are hospitalized, this is the moment when you lose that voice. And what do we do in the hospital? We stabilize you. So as you can see, you have a nice plateau down as you are stabilized. And we are working to reestablish this insight and positive intuition, this positive sense of self, so that we can reintegrate back into the community and hopefully have utilized some tool sets to prevent the stressor from happening again. In later slides, we will talk about the physiological pathway that mimics the psychological explanation that many of us have had as I explain that. So how do we get this story from our patients, this stress story? And some open-ended questions that motivational interviewing has become extremely famous for. How are you hoping I can help you today? How many of you have gone back to your miracle questions, those of you studying for your boards? What do you believe is the source of your problem? How many sources of problems does that addict explain to you? What kind of treatment are you looking for? Notice how these questions allow dialogue from a patient. They are open-ended and inviting, eliciting their story. What impact does your illness have on your life? At some point, we want to connect the physiological and the psychological for the patient, something that in the world of addiction is often missed. And what has contributed to your illness? We acknowledge all these pieces. One is no more important than the next, but there are moments when there are priorities, and we can speak to that hopefully later on. And one of the questions that I think speaks to aligning with your patients is, if your tears could speak, what would they say? So what do? We often talk about the perception of stress. It's how you see the problem. You saw the artist's perception of stress, and often we can identify these stressors as maybe something as catastrophic as 9/11, maybe a life change or trauma. And we have intervening factors of how we perceive it. We talk about personality, and we talk about always getting social supports and coping behaviors. But do we talk about the psychological, physiological stress reactions? Many times we talk about the emotional, but we don't speak to the process of how we perceive this stress. And so I often use an ABC model. And in this ABC model, it's when we define the problem, we often look at the behavior. And maybe by the time in the world of addiction, somebody's coming in to talk to you, they're speaking to the consequences. But in prevention, we spend more time looking at the antecedents, or the A. What trigger provoked that illness? And your job is to look at how those triggers and antecedents and mediators aggravate the symptoms. And so as we progress through the next couple slides, we're going to talk about physiological triggers, neurological triggers, and think about the psychological triggers that you probably are assessing on a day-to-day basis. And think about how those impact your ability to achieve your goal. What happens when something as simple as not getting enough sleep or a lack of exercise keep you from reaching your objective? and how we need to address these elements. Many of us focus on the role that neurotransmitters play in addiction. And I like this slide because if we focus on the orange section, it says what's common between norepinephrine, serotonin, and dopamine. We're talking about mood, why we do what we should do, why we don't do what we should do. And it's really connecting mood with the cognitive function. Certainly we will talk, and if we have more time later on, we'll talk to the specifics of norepinephrine with concentration, and if you don't have that, how it makes it difficult. We'll talk about dopamine and the role that that has with your motivation, which certainly needs to be addressed, and of course anxiety. Elements that we see in the role of a neurotransmitter that are consistent throughout our treatment protocols. So these mediators can be cognitive, they can be emotional, and they are what define how we appraise this situation. Later we will see slides talking about a sympathetic and parasympathetic response that is all about fight or flight. If we think about psychology, we can talk about the actions, how someone perceives a stressor and how they respond to fear or pain or loss. And as we go through the next couple slides, we're going to talk about the biochemical networks that regulate these responses that often we do not see. So we may talk about how someone interprets the cognitive process happening in the cerebral cortex. We may talk about what motivates somebody emotionally. And then we'll certainly talk about how services like EMDR and biosound and TMS and NAD are triggering certain parts of the brain and these roles. But what I wanted to speak most about is how addiction affects the brain and how the brain communicates with the body. So often we hear about something called the HPA axis, and I will outline that later. But what we're looking at is the brain's reward center. It's how the drug or the alcohol will boost one of those neurotransmitters, and how that may present you with a pleasurable feeling, and how that may result in promoting more cravings. And we define a memory as we experience that in the amygdala. And this long-term substance abuse creates this stress response system. And while we can't see the nucleus accumbens or the amygdala or the limbic system, what we can do is see the connection that stress has. We can see from a neurological standpoint the communication that the brain gives to the rest of the body, often communicated as afferent and efferent, to and from the brain, to the endocrine system, how we digest the nutrients that we're given, to a neuroendocrine system that we will outline in an HPA axis, often what you see and what you think about in a fight or flight response. How about your immune system and the connection? So stress is a model that impacts our bodies psychologically, physiologically, and there's a biotranslation that is bidirectional. And so we can look at the communication between the hypothalamus, and let's just make it simple for the sake of time, down to the adrenals, which control your stress response. And we can take this population of, in this case, an alcoholic or a drinker, and we can say, well, what's happening to cortisol? a stress hormone that many of us are familiar with. So when you're the social drinker, maybe this is part of a family culture piece. Maybe this is part of you have a genetic propensity. We have an enhanced cortisol response to mental stress. And we will see habits start to form that can amplify that dopamine signal. Enjoy it. We enjoy the time that we have social drinking. Let's jump down 2 or 3 slides just for the sake of our 2 or 3 of these boxes down to the dependent alcoholic with acute withdrawal. We see the adrenals have gross elevated stress hormones, and we see that amygdala, that part of the brain in the limbic region, right through the middle of the head, increasing anxiety. And as we see an increase in anxiety, we see craving and lack of feeling and relapse that many of us focus on a day-to-day. So in this slide, what I want you to focus on is what's happening to the body during a stress response. And that stress response can be a perception. It could also be the drug of choice. And sometimes we forget that the patient may come in and be presenting with the parasympathetic or sympathetic responses. Then what I want you to focus on is the circle on the right-hand side. These are different parts of the body that often are impacted: thyroid, adrenals, nutrient deficiencies, pancreatic problems, digestive problems, neuroendocrine, muscular, immune, that are a presentation amongst themselves that are all changing as we deal with addiction. And as we wrap up, this is just one study that looks at the neuroendocrine effect of somebody using opiates or cocaine. And we see a suppression of the HPA axis. Remember, that's H stands for your hypothalamus, think emotional regulation. Pituitary, adrenal, think stress hormones. And what happens is we see either a suppression or we see an activation of this HPA axis. And what does that mean? Slow heart rate, restricting lungs, bile secretion, and what's happening psychologically to this individual. Low energy, lack of feeling, dysthymia, maybe their sleep is thrown off, and we can go through that list. Hopefully what I've done for each of you on the call is just giving you a tease as to the connections between the mind and the body, how integrative care is a growing field that utilizes stress as an underlying glue, and how the world of addiction is a great model to highlight whole person integrative care. Thank you for your time. I appreciate it.
Once you leave today's webinar, you will receive a thank you email within 24 to 48 hours with all the information pertaining to this webinar and how to earn your CE certificate. This presentation will be available to watch after 72 hours on www.solveinstitute.com. Thanks again for your participation. We hope you found this information valuable.